A recent article published in the New England Journal of Medicine has caused quite a stir in the medical community as a surgeon opened up about his own horror story of performing the wrong operation on a patient in the OR. Now, this stunning admission has caused many to wonder just how possible and prevalent are such mistakes during surgery. Well, joining us with some important information for surgeons and patients on this matter is Dr. Christopher Magovern, ABC News medical contributor and cardiothoracic surgeon at the Morristown Memorial Hospital. Dr. Magovern, thanks so much for joining us.
Good to be here.
So if you wouldn't mind first walking us through this harrowing story in the New England Journal of Medicine.
This was a horrible story, Tanya. This surgeon from Boston was intending to operate on a woman's finger, but mistakenly operated on her wrist. And this event sadly happens from time to time. But the unusual nature of this event was that this surgeon came clean and offered a mea culpa right away, publicly. And we've learned a little bit about what's happened now. Do I give him credit for coming clean? Absolutely, that's great. We might learn something. Does he get a pass for what he did? Absolutely not. That was unforgivable. But I think we need to move on and try and learn a little bit about what happened here. He has an explanation that it was really a chain of events. It wasn't just his fault. It was his staff, and they were rushed, and they had a new team, and they had a different operating room, which is all fine. Maybe the team did drop the ball a little bit, but still the surgeon in the operating room is the captain of the ship, and he's the one that has to really be held responsible.
So the ultimate responsibility does lie with the surgeon.
It does, and I think he knows that. And I don't think, Tanya, this means that we need to run him out of town.
Right.
Chances are he's a good surgeon,
right,
and probably not a bad person, but he probably made just a horrible mistake.
And thankfully, in this particular case, no lasting damage was done.
There was
correct?
no lasting damage.
Right.
So he and the hospital need to sit down and figure out how that never happens again.
Now, moving on from there, what can we learn from this situation? You said it seemed like there were a couple of weak links in the team. Is that right?
There were a couple of weak links, and what you need to realize is that it's an absolute team effort from the beginning to the end.
And so is the communication key here?
Well, that's it's funny, Tanya. What's the reason that these things happen? Humans make mistakes. And sadly, when a human is a policeman or a soldier or an airline pilot or a surgeon, these mistakes are big, and that's a big problem. And rightfully so, we should be very frustrated and concerned about this. These problems usually happen because of a failure in communication. The team doesn't work properly. There are other reasons. It can be complacency, it can be that you're trying to rush, it can be that you're fatigued or stressed, but usually it's failure to communicate.
So walk us through, if you would, just the sort of the nitty-gritty of the procedure that goes before an operation. I mean, is there an attending nurse that writes down what's supposed to happen? How exactly does it build up to the operation? This
is really fascinating, Tanya, because we've actually learned from the aviation industry how to do this properly. In the 1950s and 1960s, fighter pilots transitioned from flying propeller aircraft to jet aircraft. So from a slow, easy-to-use aircraft to a very complex machine. And there were a lot more accidents. The Air Force then sat down and said, we have to make these pilots go through a certain checklist before they get on the plane and before they operate the plane. And that's resulted in flying now, today, being one of the safest ways of traveling. So we've adopted this in medicine, and we have now a formal checklist. It's called a universal protocol, and since 2004, we have been adopting this sort of regimen. There are three main points, Tanya. The first is that we verify. When you come into the hospital for an operation, a nurse will sit down with you. What's your name? What's your birth date? What's your operation that you're planning to have? Who's your surgeon? And then she will look at all of the different data that we have, the operating room schedule, the x-rays, to confirm that that's the case. You'll go into the operating room, you'll meet another nurse. She'll do the exact same thing, so it's duplicated. The other thing we do is we mark the site. If you're going to have an operation that has a left or a right, that has an organ that has a left or right on it, the surgeon has to come and with an indelible pen mark the spot exactly where he's going to do the surgery. And the third thing we do, Tanya, is what's called a timeout. It's not like a timeout you give your 2-year-old when he's misbehaving. But the surgeon, just before he's about to begin the operation, takes a pause and just steps back and tells everyone, wait a minute. This is the name of the patient. This is the procedure we're going to perform. It's the right or the left. Are we sure the medicines have gotten in him before we're starting the operation? And do we have the proper equipment? And you can't start the operation before that. I have nurses that will not give me the scalpel before I go through that little checklist.
So this sounds very thorough, Dr. Magovern. Do all hospitals have the same procedure?
Most hospitals do. Accredited hospitals do this. And that's one of the things that you have to look for if you're a patient, that you go to a hospital that has this sort of protocol.
Absolutely. So taking this into consideration, how often do mistakes happen? Because again, this sounds pretty thorough.
Thankfully, not that often. It's devastating when it does does happen, but it's in no way an epidemic.
Right.
The likelihood of this happening is 1 out of 50,000 operations, which is rare. But we do so much surgery in the United States. We do 20 million operations a year, so these events will happen. The average busy hospital will probably have this event happen to them once every 5 to 10 years.
Once every 5 to 10 years.
Yeah.
So what do you think that we can do going forward to improve those odds even more?
Well, we have to be vigilant, and we have to honor the universal protocol and take it seriously. We also have to stay focused, pay attention. When you're an airline pilot and you're flying less than 10,000 feet, pilots don't talk to one another unless they're talking about exactly how they're flying the plane. There's no chit-chat.
Right.
Maybe we could learn something from that. The beginning of an operation is a critical time when everyone really has to stay focused and pay attention. We also have to make this a team sport. Get everyone in the operating room together, focused on patient safety. And the last thing we need to do is acknowledge these problems when they come up, because we can learn from them so we can push ahead.
Is there ever an issue with overscheduling, that sometimes there are too many operations?
Sure, Tanya.
Yeah.
I mean, one of the problems is that we rush.
Yeah.
Surgeons are reimbursed less, so they have a tendency to want to do more cases during the day, and hospitals have a tendency to want to cram as many cases in. So there's a tendency to turnover. The best thing you can do is just take a deep breath, slow down before you start.
And don't forget that timeout. I love it.
That's right.
All right, Dr. Christopher Magovern, thank you so much for that. And remember, for all the latest in the world of health and medicine, you can head to the health page at abcnews.com.